Hi, everybody. I'm here at the Bootlegger today. I'm part of the Nevada Policy Research Institute panel that's going to be talking about the all-important issue of healthcare. I'm going to be speaking about what it's like as an employer here in Nevada to have healthcare, what we've been through, what our employees have been through, what does it look like for the future. Part of the panel will be discussing what we're doing with Obamacare in the state, what we're doing with the navigators and the facilitators here in the state. We've got a wonderful panel of people who will be talking. It is a packed room full of people who are interested in what's going on in healthcare here in Nevada. So I'm excited to be part of this panel. I'm flattered to have been asked as a business owner to participate, and I hope that by the end of the day we can come up with some kind of a direction, some kind of cheery news and during this holiday season to know what we're going to do in the future.
But given the fact that this is a federal law, what course can or should the state of Nevada pursue in order to protect itself and to cope with this new reality?
Well, there's a couple of things. For those of you who are old-timers here, you might remember during the '95 legislature, we fixed workers' comp. I see Terry Graves there who's nodding his head. He was absolutely involved in helping us figure out the course of how to fix a broken, bankrupt state system called SIIS, and we privatized it. So I would say that we really moved the state forward by digging in and fixing a system that we use now. And those of you who are in business know that you have a choice now of who you use for workers' compensation. We didn't have that prior to '95. So I have an interesting perspective of what the state's doing right now. I have some information. I don't like to quote the New York Times ordinarily, but that's where I got this from. In Nevada, for the first full month, 82.4% of new enrollees were enrolled in Medicaid. That's a little more than 5,700 people were enrolled in Medicaid, and 779 people are paid as of Friday for the individual health care policies. So if we continue on that course, that is a very expensive course for this state to be looking at. Our Medicaid budget could be bigger than our education budget in time. And even though we have these federal subsidies coming in right now, that could change. It's not supposed to change for 3 years, but it could change next year. Who knows? It could change anytime. What's also troublesome to me is that one agent who was here today in particular said that he has enrolled 2 people who are wealthy, what we would consider wealthy, but they have no income. And so they qualified and they took the Medicaid option here in Nevada. So we have people who own homes or own a business, have IRAs or whatever they have for savings accounts, but they have no income. And that's all you have to show is that you don't have income coming in. So we have 2 that I'm aware of today who are on our Medicaid rolls who are people who could afford it. And that's a huge loophole as far as I'm concerned that needs to be fixed pretty soon. But for the future, what do we do for the future? We could look at other states, for instance, that have had success stories like Kansas, like Florida, Florida did a pilot program where they pooled these high-risk Medicaid patients and had various HMOs. It's been so successful in Florida, these pilot programs, that they're expanding it statewide. And as we all know, Florida is like a state, it could be its own country, it's so big. But they've had successes where they've reduced the number of Medicaid patients. And that's what we should be looking at. Right now, we are in the middle of the largest expansion in the history of the state of Nevada, and that frightens me.
Sue, how do you see this continuing to play out from a business standpoint?
Well, as I mentioned earlier, we're already being proactive because we have to for next year. We've already been in discussions with a doctor or 2 in Bullhead City because we're in Laughlin. Bullhead City is our bigger city there. It's closer than coming here to Las Vegas. We're already in discussions with other casinos, other businesses in Laughlin for us all to pool together and everybody go to this one clinic that we're looking at in Bullhead to try to satisfy the requirements of Obamacare. The saying, if you liked your doctor, you can keep them, that's done. That's done already. And certainly by next year, you better like this one doctor that we are talking to, because he's going to be the primary caregiver for our employees and probably a lot of employees in Laughlin. But we are, we're America, and we are the land where we figure things out. Despite these impediments, we're going to figure it out. And hopefully it'll be tweaked and it'll be worked out where it'll be something we can live with. But we're not standing by watching or waiting to see what happens. We are being more proactive and thinking that this is the law, that we're going to figure it out for our business.